Good afternoon, everyone. I am Lubna Ahmed Jalal from CSC third year, feeling elated to see you all in the hall, supporting the fighters, admiring the survivors, honoring the taken, and never ever giving up hope. Wearing pink and making this October a pink October, I take increase awareness and reduce the stigma linked to the symptoms and treatment of breast cancer. Breast Cancer Awareness Month also encourages them to get regular screening for early detection of cancer, as it can save lives. People wear pink ribbons to honor survivors, remember those who lost to the disease, and to support the progress we are making together to defeat breast cancer. Because when fear knocks, faith answers the door. IEEE OUC Women in Engineering chapter in collaboration with UVA presents ABCs of Breast Health by Dr. P. Raghuram, Officer of the Most Excellent Order of British Empire 2021, Director and Consultant Surgeon, KIMS Usha Lakshmi Center for Breast Diseases, KIMS Hospital, Hyderabad. I feel privileged to extend my warm welcome to all our chief guests. Now, it gives me an immense pleasure to introduce and invite onto the dais Dr. M. Manjula Ma'am, Faculty Coordinator of WIE, Professor, Department of Electrical Engineering, UCOE. Please, ma'am. Her areas of interest are power systems, microprocessors and microcontrollers, and many more. Ma'am did her undergraduate, postgraduate, and PhD from Osmania University. Thank you, ma'am. I would like to introduce and invite onto the dais Dr. Sriram Venkatesh Sir, Presiding Officer, Principal of the University College of Engineering, Osmania University. Sir completed his PhD in the field of design of bulk solids and equipment. He has published 110 papers in various international and national journals and conferences. He has 26 years of teaching and 2 years of industrial and research experience. Thank you, sir. Next, I would like to invite onto the dais our Registrar, Professor P. Lakshminarayana Sir, Department of Mechanical Engineering. Professor Lakshminarayana Sir has over 30 years of teaching, research and administrative experience. He has published about 110 research papers in various international and national journals and conferences. He guided several PG and PhD scholars in the field of mechanical engineering. Thank you, sir. Now, with immense honor, I would like to invite onto the dais the speaker of today's event, Dr. P. Raghuram, the founder and the director of KIMS Research Center for Breast Diseases. He is the founder of International Breast Center Foundation, a non-profit organization, and Faith Connection, a quarterly newsletter about breast health care. He is best known as the youngest recipient of the Overseas Gold Medal of the Royal College of Surgeons of Edinburgh, and in 2021, he became the first surgeon of Indian origin to be conferred the honorary fellowship of the Association of Surgeons of Great Britain. Thank you. He is one of the youngest surgeons of Indian origin in over 100 years to be honored with Officer of the Most Excellent Order of the British Empire. He is a recipient of the Edward Kennedy Memorial Award for improving the art and science of breast oncology in South Asia. He received the fourth highest Indian civilian award of Padma Shri in the year 2015, making him the youngest surgeon from the southern Indian states of Telangana and Andhra Pradesh to have been conferred the award by the President of India. In 2017, the Medical Council of India selected him for the Dr. B.C. Rao Royal National Award for Outstanding Service in the field of social medical relief for 2016. We are very much inspired by your noble achievement, sir. Now, I would like to request Dr. M. Manjula, Faculty Coordinator of WIE, ma'am, to speak a few words about the event.
Good afternoon, everybody. Respected chief guest of this today's event, Dr. P. Raghuram sir, guest of honor, Professor P. Lakshminarayan sir, Registrar, Usmania University, Professor G. Ballesham, Dean, Development and UGC Affairs, Usmania University, Professor Sriram Venkatesh sir, Principal, College of Engineering, Usmania University, and my dear students. Good afternoon to all of you. So when somebody asks, how are you all? How are you all? So this is what everybody says. We are fine, I am fine, doing well, good. But when it comes to a severe problem, health issue, okay, so you don't know what is happening internally inside your body, okay. So this is what I think today the students have made a very bold move to talk about the subject cancer, and it is affecting so many people. So already we have gone through 2 years of pandemic where everybody has been touched upon on the health issues. So every family, everybody has gone through this in the pandemic with the corona. So now I really appreciate our students, College of Engineering, the WIE, Yuva, Women in Engineering. They have taken a very good subject, and it really takes courage to talk about the subject of today, that is cancer, and especially the breast cancer or the health about the ladies. So it is the least priority, generally least priority given to health. And when it comes to ladies, and you know what actually happens when the ladies go through, and the working women. So I am looking forward to our chief guest today, Dr. P. Raghuram Garu, who has come all the way here to the engineering college to give us many tips or have the awareness about the breast cancer in ladies, and mostly the cancer, which is a very severe problem which takes away lives. Okay. So I have the opportunity of welcoming sir also for this event. I am looking forward for sir's lecture. Thank you so much. Thank you everybody.
Thank you, ma'am, for your enlightening speech. Now, I request Dr. Sriram Venkatesh, Presiding Officer, Principal of the University College of Engineering, Usmania University, to address the gathering.
Chief guest of today's function, Dr. Padma Shri Raghuram Garu, guest of honor, Professor P. Lakshminarayan, Registrar, Usmania University, Professor G. Mallesham, Faculty Advisor, IEEE, and also Dean Development and Business Affairs. Professor Manjula, the Faculty Advisor for the girls. Faculty members, my dear students, good evening to all of you. At the outset, I congratulate all the organizers, UVA, IEEE, whatever, for organizing such a wonderful and first of its kind in nature, which will give awareness on health of the breast, the breast cancer, by eminent Dr. Padmasri Raghuram Garu. Sir, on behalf of my students, I thank you very much for sparing your valuable time, because I know doctors are how busy they are, particularly in this area, oncology, and waiting together, hours of together, even in spite of paying fee, prescription, everything is ready, but we have to wait hours of together to consult the doctor. But as such an eminent personality, Padmasri Awardee, President Awardee, and so many awards are there, you can see. But because of your love and affection on students, our institution, you have accepted our students' invitation and coming over here to give your valuable address to all our faculty members and students. Sir, our students are very active. Less than a week time. I think this is the third program we are conducting in the same hall. First one is the IEEE interaction session. Second one is the blood donation camp by UVA. And this is the third program on ABCs of health of the breast. So after Corona, our students have become very active, and they are conducting so many events. And I am also for the students to conduct such programs. Only thing is there should not be any dislocation to the academics. So you have to find out or to take out some time to organize such a socially relevant programs as this. And like music club is there, SA Maha is there. So many clubs are there. Some of the clubs are very active and getting prizes also. And the only thing is, my request to all the students is, you have to showcase your events. Who knows, after 1 hour or 2 hour of time, who knows, nobody knows whether you are conductor or not. So that's why I request all the organizers to showcase your video, your photographs, and place in our social media, and also release to the press and electronic media to publish it. So that is for you also it is good, for the institution also it is good, for getting better ranking and to know the people in the society that University College Engineering students are doing a lot, and you will be getting a lot of appreciations. So this is the third program, but I did not receive any so far the other videographs or photographs. So I requested the public relations officer madam to upload in our social media so that you will be get benefited and the society knows what we are doing. So once again I request the all organizers to do immediately after this, and we are ready to provide whatever the facilities you want, whatever the help you want from the institution. I am ready to extend, and also thinking of giving some seed money for the clubs to transfer further, to earn money, to grow further, and to organize wonderful programs, workshops, etc. like this. So with this, I thank you for the organizers for giving me opportunity. Thanks for that.
Thank you, sir, for your valuable words. Now, I would like to invite Professor P. Lakshmi Narayana, sir, Department of Mechanical Engineering, to speak few words about.
So, namaskar to everyone. And respected ladies on the dais, Dr. Raghuram Garu, He's a Padma Shri awardee and is a busy doctor and presently is the director, Kim's Usha Lakshmi Center for Breast Diseases, and also founder and the CEO for the Breast Cancer Center, Hyderabad. And my colleague, Professor Sri Venkatesh and Professor Manjula and Sudhaman, Nagavedi, and my dear respondents. We are very happy for organizing this lecture by Professor Dr. Raghuram Garu because it's very useful. All you know that coming together also is very difficult. But here I think the students are coming together. One is University College of Engineering, Women in Engineering, IEEE, UR, and all other organizations coming forward, take up a good cause to create the awareness among the girl students and the women employees. So you people, you have to spread it. You listen it here and forget, there's no use of it. Go and discuss with your parents, your sisters, and your sister-in-laws who are living in your house. Try to discuss with them and enlighten them and explain them. Even you have any finding or you observe anything in the society, your neighbors, please interact with the doctor. If you can ask the question, that answer will remember forever. If you don't ask any doubt, etc., any question, just you will listen here and forget about it. So that's why this is a good opportunity because like Venkatesh told that the doctors are really very busy. If you can go to the approach a doctor for consultancy, you have to wait for 2-3 hours. If the doctors taken time for all you people, put together all the time, because every person is waiting 1 hour means is spending time for us 2 hours or 3 hours in our college. So thank you very much sir for coming here and interact with our students. It's really very kind gesture. And social awareness, how best socially you are moving, this is very important. I'm requesting the same organizers who are organizing this, even organize for the only women employees and the girl students only. You have to interact with everyone. Whatever the things you are learning it here today, you can interact with them again. It's a kind of workshop, say 1 hour or whatever maybe. If you can go to any lab, there some women employees are there. If you can go to the hostel workers are there. You can talk to them, friendly, nothing is there. Just only how are you and all, how you are doing. So madam asked you that in the beginning, how are you? All you said that fine. But all are not fine. But only for asking you are saying that word, yes, no answer kind of way, it's not good. But okay, we say yes, and I think everyone should be fine only for always, forever. If any small things comes, we can go together and discuss with them and try to help them and spread this awareness. I think we know that earlier this cancer was not there in the olden days. Just now I discussed with the teacher, the doctor. When I was young in 1966, I used to drink the milk up to the age of 5-6 years. But now only the parents are giving milk only for 4 months or 5 months. Maybe that may be one of the reasons for getting the breast cancer. I don't know exactly. But what I am observing here, I think every 8 people are approaching the doctors, or every 8 people are on the globe, 1 person is detected by this kind of diseases. The cancer is very dangerous diseases. But how to prevent it? If you can, early detection is going to be detected. The Sar is told that in that. Know your symptoms and detect early stage, you can save your life. That is the only thing we have in our book. That's the only option we have. Symptoms, detection, approaching the doctor in the beginning only, you can save the life. If you don't discuss with anyone, your parents or sister, brother, so there only you have to think about that. Whatever may be the symptoms. If headache is means, immediately say that. If you don't tell anyone, that will be converting into some other diseases. So that's why whatever the symptoms are there, can even nowadays technology is more technology available. So you can type it in there what it is kind of things. Just you can approach the doctor, talk to them, they can suggest you. So thank you very much for inviting me, especially Naina for inviting me. This is a social cause. That's why I told her that definitely I will come and address you. And with these few words, I thank you once again, Dr. Raghav Garu and the organizers and the management of this college. Thank you. Good luck to everyone.
Thank you, sir. Now, I would like to invite Dr. B. Raghuram, sir, the founder and the director of KIMS Usha Lakshmi Center for Breast Disease, to address the gathering and enlighten us with his valuable knowledge and experience.
Professor Lakshmi Narayan Garu, Professor Sriram Venkatesh, Professor Manjula Garu, the Usmanians who have come here, and I'm very grateful to Lubna and her team who have come over to invite me. When they came, I was not really sure as to how many will be here until I came here. And the passion with which they have organized this event, bringing together 4 organizations within the university alongside the Hyderabad chapter of IEEE. So I think it really means a lot to me because I'm here standing before you as a representative of Usha Lakshmi Breast Cancer Foundation, which has been working over the past 15 years to create awareness about the importance of early detection, because that is the key. And I'm so glad that all of you, in addition to your academics, are taking great interest in social causes, as the previous speakers have alluded to. So as they say, everything begins with a story, and my real story began when my mother was diagnosed with breast cancer. That was the time I was working in the UK, and I had no plans to come back to India. And that is when my mother was diagnosed with breast cancer. That's when I started inquiring as to how breast health care is delivered in our country, and I realized that because of lack of awareness and absence of a robust screening program, more than 60% present in the advanced stages. So my family and I took a conscious decision to relocate to Bharat and to work alongside individuals, organizations, the government to make a meaningful difference to the delivery of breast health care in a country that I was born and raised. So over the past 15 years, thank you, I have been serving as a living bridge, so to speak, between the United Kingdom and India, trying to replicate whatever I have learned and absorbed in the United Kingdom in terms of improving breast health care in our country. I'm not here to scare you because there's a very fine line between advocacy and scaring people. So I'm here to empower you, and that is exactly the way I would like to keep it. But I must mention about certain startling statistics in our country. Not only in our country, breast cancer has overtaken all the cancers put together across the world, including lung cancer. It is the commonest cancer affecting people across the globe. But in our country, breast cancer, of course, is again overtaken cervical cancer to become the leading cause, and someone somewhere is diagnosed with breast cancer every 4 minutes. If you look at this slide, this is the hospital-based statistics from Tata Memorial, which has been generated there, hospital-based, population-based, hospital-based cancer registries. Whereas in the West, you see majority of breast cancers over the age of 50. Whereas in our country, we see breast cancers in young women, and the peak incidence is between 40 to 50 years, a decade earlier than the West. Why is that so? I think it is because we have a very broad-based pyramid where 87% of our population are under the age of 50 and only 13% are over the age of 50, and that's probably the reason why we are seeing a lot of breast cancers in young women. So in our country, it's a closet issue, it is a hushed up issue, and as I mentioned earlier, lack of awareness, absence of a screening program is the main reason why so many breast cancers present in the advanced stages.
This is a lady who has come from Hyderabad. She's obviously has a locally advanced breast cancer because she doesn't want to talk about it and she presented to us late. And it is because of this that nearly 1 lakh women succumb to breast cancer every year. This is only the tip of the iceberg because we don't have robust cancer registry in our country. So every 8 minutes someone somewhere succumbs to the disease. So the foundation, when I decided to come back, the first thing I did was to establish a not-for-profit foundation, and this foundation aims to create awareness, to reach out to the community, which is what I'm doing today, and to support the breast cancer survivors in their fight against breast cancer. But the main chunk of my talk now will be to dispel some of the common myths, not only associated with breast cancer, but benign non-cancer breast health issues, which is far more common than breast cancer. So, one of the commonest myths is that when someone notices a lump, she thinks it's a breast cancer. The answer is no. 9 out of 10 breast lumps are not cancers. Only 1 out of 10 is a cancer. But when someone notices any new breast health issue, they should not ignore. They must go to a doctor. And what should the doctor be doing? They should be doing what is called triple assessment. That is, talking to the patient, comforting the patient, taking the history, examining. That is the first component. The second component is doing a combination of mammography and ultrasound scan. The third component is biopsy under ultrasound guidance. So if any of your relatives with a breast health issue goes to a doctor with a breast lump or anything and they say, okay, please come tomorrow, we will operate, then you are in the wrong place. Triple assessment will help to distinguish between a cancer and a non-cancer without the need for the lady to go under the knife. So triple assessment is what somebody should have. Now, just because I'm a surgeon, just because I've been trained in the UK, just because I'm highly skilled, it doesn't mean I'm great. No, no way. No one individual can make a difference. You need a team. Just like a stethoscope is required for a physician, for a surgeon dealing with breast disease, the stethoscope is a good radiologist and a good pathologist. Without this team, you cannot function. So therefore, the first component of the triple assessment, history and examination, and it's very important to understand, this is a slide from several decades ago. Nowadays, as soon as the patient comes, the doctor starts writing the prescription even before talking to the patient. Whereas, what has been proven and what applies even today is by talking to the patient, by examining the patient, 93% of the time you can get the diagnosis without the need for investigations. I'm not saying that investigations are not required, but what I'm saying is it's so important to talk to the patient, take the history and examine. And counseling, which is so often ignored in our country, where people need to be spoken to, they need to be comforted, they need to be reassured. That is what never happens, because in cancer, you can cure sometimes, you can relieve often, but as a doctor, one should never ever forget that it's important to counsel the patient always. Naturally, patients get upset when you don't talk to them, and you can look at this cartoon, you can look at this doctor who is talking down to that patient. You can see that patient, she's sitting at the edge of the chair. She doesn't even have the courage to ask any questions because she thinks that the doctor will get upset. Whereas you look at this cartoon, used to take an X-ray of the breast, and under ultrasound guidance, the third component is a biopsy, a needle biopsy. Where a needle biopsy is done, you can see that white structure in the lesion. We take a picture so that we can show it to the patient and reassure that patient if it's not a cancer. Why do you need a biopsy? Why not just take history and examine and do a mammography and ultrasound? Because the biopsy is of two types. One is fine needle aspiration. Why I am telling you this is you're all educated. Your mothers, your sisters, your grandmothers, if they go to the hospital, you need to be aware of this terminology. FNAC is putting a needle into the lump and taking cells. That has largely been given up. It has actually been given up entirely. What should happen is, if there is a lump in the breast, under ultrasound guidance, they must have a core needle biopsy. Core needle biopsy. That's also a needle biopsy, but it is done under ultrasound guidance. We give local anesthesia, put the needle into the lesion, take a tissue. It is like doing an operation without the need to do an operation. But fine needle aspiration is just putting the needle and taking cells. You get wrong diagnosis sometimes, even false positive diagnosis sometimes. So that's given up. So if you go to a hospital and someone recommends FNAC, then say, thank you doctor, and you must not get it done. It should be a core biopsy. So the first and foremost and most common symptom that someone presents is breast pain. 9 out of 10 women in their lifetime will get breast pain. And breast pain means equals to no cancer. When someone has breast pain, he or she thinks that it's a cancer, but it is not. It occurs because of increased sensitivity of the breast tissue to the circulating hormones. And a lot of times, this is very badly managed with various drugs such as evening primrose oil, danazol, so many medicines the doctors write. What is required is reassurance. After triple assessment, what is required is reassurance that this will not be a cancer, and to sometimes wearing a correct fitting bra also helps. Many times stress can cause breast pain, so it is reassuring the patient that is required. There is no need for any medication by and large unless it is very, very, very severe. We do prescribe certain medications, but by and large, no medicines is required. The second, why am I speaking about non-cancer issues? Because they are more common than cancer. 9 out of 10 people who present with breast health issues have non-cancer issues. The second most common lump that we find in young women is something called fibroadenoma. It's called a breast mouse because it freely moves, and it has got typical features both on mammogram and ultrasound. And what we do is, as I was talking to you about core biopsy, under ultrasound guidance, we put the needle and take a little tissue. We show it to the patient so as to reassure the patient that it is not a cancer, and we bring them back after a few months just to do an ultrasound. Just because a lump is there, there is no need to undergo an operation. If we can prove that this is a fibroadenoma on core biopsy, we can reassure the patient, unless that lump becomes very big when we call it a giant fibroadenoma, like over 5 centimeters or something over 3 centimeters. That is the time that we would consider surgery. Many young women, it hurts me when they come with multiple fibroadenomas who have been scarred already. They go to a doctor, the doctor excises that lump, excises many lumps, and by the age of 25, she's got multiple scars. That is something that should not be done. When someone presents with fibroadenomas, small fibroadenomas particularly, there is absolutely no role for surgery. The third common condition that we come across is what is called cysts, which occur in little older women, maybe between 40 to 50 years. They suddenly present with a lump in the breast, which alarms them, and what is required is again triple assessment, reassurance. There is no need to do a needle test unless that cyst is very big, causing discomfort. That is when we remove the cyst fluid, and we don't need to send it for any cytology. All that is required is the cyst fluid is removed, discarded only when the lump is very large, only when the lump is causing discomfort. Again, I am emphasizing the basic principles because when you are told that there is a cyst, immediately the doctor would say, we'll do an operation. There is no need to do an operation for this. Only rarely, very rarely, 1% of the time, that cyst may harbor a cancer. That is called intracystic cancer. And that is the only time when we need to do a core biopsy of that solid lump within that cyst. But it is very, very rare. Now, coming to breast cancer, the commonest myth is breast cancer occurs only in older people. Yes, it is true, but in our country, young nation like us, lot of breast cancers are seen in young women. When I was in the UK, I would see perhaps one or two breast cancers in women under the age of 40. Today, almost every week on a daily basis, we see women presenting with breast cancer under the age of 50. So it's a myth as far as our country is concerned. To the men who are sitting here, you may think that breast cancer doesn't occur in men. Men also can get breast cancer, but it is rare. It's not common, it's not uncommon, it is rare. 1 in 100. And men have less breast tissue compared to women. So therefore, it can spread very fast. So any changes that a man also notices, they must not ignore. So what are the changes that one should be aware of? If there is a painless lump in the breast, if there is a recent indrawing of the nipple and a blood stain discharge, not clear colored, green colored, yellow colored, blood stain discharge, or there is puckering of the skin overlying the breast, or there is eczema around the nipple areolar region, or there is dimpling of the skin overlying the breast, then it doesn't mean it's necessarily a cancer, but they should not be ignored. When such symptoms are there, they must go to a specialist and get the triple assessment. That is the gold standard. Now you will see from time to time, particularly this is October, the foundation illuminates various monuments and historic buildings and bridges. Recently we had the Durgam Cheru bridge also illuminated in pink, the Charminar, the Buddha statue, Ravindra Bharati, Prasad Sai Max, the King's Hospitals where I work, and the Durgam Cheru and the Raj Bhavan. The only Raj Bhavan in the country, thanks to our Honorable Governor, it has turned pink for the third consecutive year. We started during the pandemic year when it was difficult to go out and requested the government regularly. So, why do we illuminate it pink? Pink and pink ribbon stands for breast cancer awareness. This is a movement that started 3 decades ago. So when someone notices a pink building, it raises that curiosity. And that is what, we have been doing over the past 10 years. And although White House, Buckingham Palace, Eiffel Tower, many such prominent buildings turn pink, Hyderabad is the only city in Asia Pacific region, maybe in the world, where several monuments, not one monument or two, several monuments turn pink in October consistently over the past 10 years. Now, do we know what causes breast cancer? As I was telling Professor Lakshminarayan Garu, we still don't know what causes breast cancer, but we know that there are well recognized risk factors. What are the risk factors? Being a woman, obviously, previous history of breast cancer, and any factor that increases the exposure of the hormone estrogen for a prolonged period of time on the breast, like early menarche, late menopause, not having children, having the first child after 30, not breastfeeding them, and as Sir has said, not breastfeeding them enough. A lot of people breastfeed for a short time. So when someone breastfeeds for a longer period, more than 1.5 years, the protection is better. Why? Because it breaks that uninterrupted exposure of estrogen. Because when someone is pregnant and breastfeeding, various other hormones take over. So therefore there is an interruption in the estrogen hormone. And obesity, particularly after menopause, because fat cells produce estrogens that can cause breast cancer. And of course, family history. Coming to family history, I'd like to highlight that just because my mother had breast cancer, my children are not at an increased risk. What I am referring to is genetic abnormalities called BRCA1, BRCA2 abnormalities, and we see them in a certain group of people. Who are they? In the immediate family, if someone is diagnosed with breast cancer under the age of 40, or there are 2 or more breast cancers in the immediate family, or there is a history of breast cancer and ovarian cancer, or male breast cancer in the immediate family, that is when alarm bells should ring and the genetic counseling must be done, which should be followed by genetic test. Because you must have heard about Angelina Jolie. She had a prophylactic mastectomy, that is removal of the breast even before cancer. Why? Because she comes under the category of the familial breast cancer, where the genetic abnormalities in BRCA1 and BRCA2 means that there is an 85% risk of her getting breast cancer. That is, if she lives or women like her live up to the age of 85% of them will get breast cancer. So just because one member is affected, one need not worry. It is these specific criteria when they are there. Again, not to panic because it doesn't mean it's a cancer. They must get genetic counseling before doing the genetic test. In fact, Angelina Jolie has done a lot of disservice because of the panic. Every hospital now in the country, they have got genetic clinics, genetic testing. So without even asking the patient, without even doing counseling, they order this expensive 50,000 rupees test. Most of them don't require the genetic testing. So this is the beautiful legislative assembly building and the only legislative building in the country that turned pink in the month of October. Now birth control pills, previously it contained high doses of estrogen, not anymore. They contain low dose estrogen, so they are not at an increased risk. Breast self-examination, you would have read in the newspapers about breast self-examination to examine one's breast at a particular time once a month. It is given up. The term now is called breast awareness, where women are encouraged because every day the breasts feel different. So women are encouraged to know how their breasts look and feel throughout the month. No set way of doing it. I told you about the common symptoms like a painless lump, blood stain discharge from the nipple, indrawing of the nipple, excoriation of the nipple, and skin dimpling. If these changes are there, they must not ignore, they must report to a specialist. So this 5-point code is called knowing what is normal for you, knowing what changes to look for, which I have just mentioned, to look and feel on a regular basis, to report any changes if there is any abnormality, and finally, you are not at that age, but your mothers, your grandmothers, your aunts, anyone over the age of 40 must get an annual screening mammogram. And that is a must. And many people hesitate to go for mammogram for two reasons. One, they think it's a radiation hazard. It is a myth because the radiation from the mammography is equivalent to a dental X-ray. So there's nothing to be alarmed about. The second reason, and of course, in this day and age of digital mammography, the 3D mammography, the radiation is very less. The second reason why women don't go for mammogram is they think it is painful. Yes, it is painful if it is not done properly because when the lady goes to the radiographer, she is very anxious. It's important for the radiographer to calm the patient, to talk to the patient, and using certain techniques, there will be only momentary discomfort but not pain. So, the two reasons why women don't want to go, three reasons. One is lack of awareness. Second is they think it's radiation hazard. Third is they think it's painful. So please be reassured that these are not true and the benefits of getting a mammography far outweighs any risks which I will come in a few moments. Now underwire bra, wear deodorants, do they cause breast cancer? They don't cause breast cancer. Can pregnant women get breast cancer? Yes, in pregnancy also breast cancer can occur. In pregnancy the breasts change, so therefore it's much more difficult to pick up lumps, so it's very important to be aware and any changes they must report to a doctor. Can breastfeeding prevent breast cancer? The answer is no, but breastfeeding reduces the incidence of getting breast cancer. Now this is a common question. You are talking about mammography. So you may say, why get a mammography? I don't have a lump. I don't have a breast health issue. Why are you asking me to get a mammogram? Breast screening. The breast screening means you aim to detect cancer before you or the doctor can feel it. many years before it feels like a lump. And that is the aim of breast screening. It's not effective in all age groups, it is only effective after the age of 40 because the breast is very dense in young women and it's very difficult to pick up cancers in very young women. So therefore, mammography is an X-ray of the breast to detect early cancer. It's not because I am saying it, because there's so much of evidence that supports that screening mammogram saves lives. This is a lady who had to lose her breast because she had breast cancer. And that is the common expression for anyone to lose their breast for breast cancer. I am talking about cancer as small as that, 5 millimeters, 10 millimeters, 1 centimeter. That lump will take 2, 3, 4 years before it shows up as a proper lump. So if a lady over 40 goes and gets a mammogram and God forbid there is a small lump like that, that lump like this, a calcification, this is another calcification, you pick it up on mammogram and this is a 3D mammogram which is much more superior to a conventional mammogram. What do? The surgeon, he can't feel it either, so he has to put a wire on the day of surgery and the lump can be removed. Not the breast, just the lump. When the lump is removed, there is bound to be a defect. So anybody who has a lumpectomy, there is a defect. In this day and age, over the past 20 years, there have been refinements in surgery where we combine oncology and plastic surgery. That is called oncoplastic surgery, where we are able to reshape the breast after lumpectomy. I am not talking about mastectomy, I am not talking about breast reconstruction, I am talking about lumpectomy. And you can see these women have scars which are barely visible. There is no defect in the breast. One of the women who is on your right had a breast cancer in the bra line, upper inner quadrant. If I made an incision in the bra line, I will leave a huge defect and a very bad cosmetic scar. So we place the incisions where it is barely visible, we mobilize the breast tissue and reshape the breast. So therefore, in this day and age, there is no need to think that mastectomy is the only way to treat cancer. We can do it very effectively with breast conserving surgery. And that comes to the main question. When someone is diagnosed with breast cancer in your family, you must ask the doctor, can this breast be preserved? And why am I saying this? Because there is ample evidence to show that breast conservation, that is preserving the breast with radiotherapy, has same survival as mastectomy. People think mastectomy is associated with longer survival. Answer is no. But I must emphasize, some women may not be suitable for breast conservation. They need mastectomy. But many women who can have breast conservation in our country are getting mastectomy. If we don't have precise statistics, but more than 80% of surgeries involve mastectomy, whereas in the West, more than 80% have breast conserving surgery. So this is the Raj Bhavan I was talking to you about, which was illuminated in pink recently. And what I have done is, because in our country counseling is not taken seriously, inspired by the Digital India campaign launched by our Prime Minister, the foundation produced a mobile app on breast health in 11 commonly spoken Indian languages and English. This is the world's first app which is freely downloadable in App Store and in Android. It is called ABCs of Breast Health. Normally, when someone downloads an app, questions are asked. What is your mobile number? What is your name? What is your age? Whereas in this, no questions are asked. It is freely downloadable. And this has been 5 years since this app was launched. This app has every conceivable aspects of breast health, which is explained in simple, easy to understand format. Every aspect, you name the breast health issue, including small issues, are there and explained in simple, easy to understand format, and of course, in addition to talking about breast cancer. And this was launched by none other than one of India's icons, and we didn't take any money to He launched this. All it took is I had to go to his house, explain to him. He needed to be convinced that this is going to be useful, and then he launched it and he tweeted about it. And the video is not working, but he promised to be the face of this campaign. And it has been 5 years, and thousands of people have downloaded it. So I think it is one thing that you can definitely do is to download this app called ABCs of Breast Health, and so that when a doctor is not answering your questions, then you have ready-made answers, and you must ask the doctor after reading the app, and it is his duty to explain to you. If he doesn't explain to you, then you are not in the right place. So I didn't want to go into too many details, but I wanted to emphasize that women of all ages, including youth, must be aware of any new changes in the breast. If there are any new changes in the breast, you must not ignore. You must go to your doctor. That is the first and foremost thing. Although there are certain preventable factors, aspects related to breast cancer, like having a sedentary lifestyle is not good, not doing exercise is not good, obesity is not good, smoking and excessive alcohol is not good, because all of them predispose to cancer. But if we have to fight breast cancer, there are only two ways. One is women must be aware. Second is early detection is possible only by way of screening. If your mother, your aunt, your grandmother, your friend, anybody is over 40, October is the breast cancer awareness month. Please do encourage them to have a mammogram every year, because you can pick up cancer several years early and you can save these lives. You can say to them when you pick up on screening that you will succumb to old age, but you will not succumb to breast cancer. Not all cancers can be picked up early. For example, breast cancer is one, oral cancer is another, cervical cancer is another, where you can pick up early. You can't pick up lung cancer early, you can't pick up stomach cancer early. So we are very fortunate that you can pick up breast cancer so early that we can effectively use the word cure. Normally you can't use the word cure in cancer, but we can use the word cure in breast cancer if it is picked up in the very early stages. And to the men in this audience, we have just crossed Deepavali, we had Dashara, and we have had many festivals like Ramadan and many others, and we are getting into Christmas. So please gift your loved ones a mammogram instead of buying a sari, or in addition to buying a sari. Please gift your loved ones who are over 40 an annual screening mammogram. That will go a long way in saving lives. You don't need to see women like this, educated women like this, from a city of Hyderabad to present in locally advanced stages. So my heart beats for early detection. That's what brought me here. I'm so grateful to the Usmania University, the College of Engineering, Yuva, Women in Engineering, and IEEE, and Lubna, and all of you for giving me this opportunity to come here and to empower you. And I'm open to questions. Please feel free to ask any questions you may have. And I'm so glad that they have allocated time, and not just 2 minutes, 5 minutes, 15 minutes has been allocated. It's so good and thoughtful of you. So I'm available to answer any of your questions. Thank you very much. Thank you so much. Thank you so much. I think mine can be faster.
Raise your hand and get the mic. Good evening, sir.
Yeah.
Will this breast cancer treatment affect fertility?
Yes, very good question. Yes, it does affect fertility, because when someone is young, there are a number of challenges. Please take a seat. Number of challenges that affect women. First and foremost, I must say that to treat somebody who is young is a challenge. That will be an understatement. In fact, I've published an invited article in the Times of India recently, which talks about some of the issues. Fertility is a major issue. So when someone is young, they may not have children, or they may have had this one child and expecting to have another child. So when chemotherapy, which is one of the treatments that's given for cancer, is given, it affects the ovaries, it makes them post-menopausal. So therefore they can't have children. So therefore there are techniques, and it is the duty of the treating doctor to refer the patient to a fertility specialist so that embryos can be retrieved and frozen and they can be used at a later date. So very, very important fertility preservation. So that's a very good question, and that's a question that you should ask the doctor before commencing the treatment.
Good afternoon, sir.
Yeah.
Sir, will the treatment be different for boys and girls?
No, there's no difference, but as I mentioned to you, in men, there's very little breast tissue. So by the time men present, they usually present in the advanced stages because you can't screen men. There's no advantage of screening men because it's a very rare 1%. There's no point in screening something which is rare. Screening is only effective when the disease is very common in the community. So when somebody presents with an advanced disease, most of the times the survival rate is very less, but the treatment remains the same. It's the same.
Sir, does stress have any impact on the breast cancer?
Yes, stress has an impact on any cancer. In fact, on in many lifestyle diseases, stress is the root cause of many lifestyle diseases, and including cancer. There's no direct, relationship, but stress does cause a change in the environment within the body, and so it's important to practice something when you are working hard. You're all working. You must find a hobby, whether it is sports, whether it is meditation. You must find a space every single day where your mind is relaxed. And only when you relax your mind, you will be able to function to the best available capacity on the following day. But if you don't, and you're all the time stressed, all the time reading, all the time focusing on your career, you do develop stress, and you may not notice it now. As you age, you will develop, symptoms very early. Hypertension, diabetes, all these things are, preventable if you follow certain principles of physical exercise and regular diet and maintaining good nutrition and avoiding stress as much as possible. You can't eliminate it.
How does menstrual history affects breast cancer risk?
Yes. So, as I mentioned to you, any factor that increases the exposure of the hormone estrogen for a prolonged period of time on the breast can cause breast cancer. So that's why I said if someone develops menarche under the age of 11 and the menopause doesn't occur at the age of 50, 55, that means it's extended period of periods. So there's a prolonged exposure of hormone. Similarly, if someone doesn't have children, then there is uninterrupted action of the estrogen. If someone has the child after 30, again it's a prolonged exposure. If they don't breastfeed, again it's a prolonged exposure. So that is the relationship of the hormone, uninterrupted estrogen hormone on the body. Yes. Sorry?
If once treated, are there any chances of getting it again?
Yes. So when someone has been detected with breast cancer, obviously they are at an increased risk of developing another cancer or a recurrence. It doesn't mean that they will recur. That is why it's very important for those who have been treated with cancer to be followed up regularly every 3-4 months, physical examination. But when they get followed up, we also see that they get PET scans. Please be aware that one PET scan is equal to 1,000 X-rays. So if a doctor prescribes PET scans serially during follow-up, which we find a lot in private practice, please be aware it's not required. All that is required is physical examination by the doctor every 4 months and mammogram and ultrasound scan once a year. That's all that is required. But why do we do that? Because to answer your question, because recurrence can occur, new primary can occur, there must be under constant surveillance. We call it surveillance.
Is it difficult for people with PCOS and PCOD?
Yeah, so when someone has, those abnormalities, there is a increased exposure of estrogen. Sometimes it can predispose. So if there is a treatment which involves, for example, fertility treatment, certain fertility treatments involve excessive hormone injections and tablets. So that also can predispose. So one has to be careful. But PCOS as such is not a predisposing factor. Yes, good question. Side effects predominantly, I think, involve chemotherapy. They are the main cause. And when young women have chemotherapy, the first and foremost thing is about the hair. Hair loss will happen because chemotherapy acts not only on the breast cancer, it acts on the entire body, and as a result, it acts on the hair cells, and therefore people lose their hair. So what I advise patients is to shave their hair even before the start of treatment, because if after the chemotherapy starts, second cycle, the hair starts falling off in bits and pieces, it's very, very traumatic. And I also encourage women, those who want to wear a wig, to get the wig designed, to wear it even before the treatment starts. And the other way, simplistic way, is to, take away the hair and just have a wig, have a scarf around the scalp, so that, it's not visible, even to her every day after she comes out of the shower. So that is the first and foremost thing. The other thing with chemotherapy does is weakness, extraordinary weakness. So one must take good nutritious diet. There's loss of appetite, and people have brittle nails, discoloration of the skin. They feel totally out. So typically chemotherapy is given once in 3 weeks. So usually the first week is the worst week, and then they come back to normal in the second and third week, and again they take it on the fourth week. So like that, the treatment is given for a period of about 4 to 6 months. So the most traumatic side effects are mainly seen in chemotherapy. As far as surgery is concerned, if they have surgery to the breast and if the lymph nodes are removed, they can get lymphedema, which is swelling of the arm, shoulder stiffness, altered sensation. So that is why there are minimally invasive techniques where we don't need to remove all the nodes. We can remove a few nodes, which is called sentinel node biopsy. It is done in a certain group of patients, not suitable for everybody. Similarly, breast conserving surgery. So refinements in breast conserving surgery like oncoplastic surgery, all these things really help to ensure that we give good cosmesis and ensure that the side effects are minimum. But chemotherapy, yes, these are things that we can't really take away, but prophylactically, nausea and vomiting can be controlled by giving medications. Good questions. Okay, someone is asking. Fibroadenoma, sorry? Yes, fibroadenoma, unless it is very large, unless it is causing pain, need not be removed. As I mentioned to you, if it is under 2 centimeters, we do a core biopsy, we prove that it's a core fibroadenoma, we bring them back for a follow-up ultrasound. There's no need to remove it. Only when it is more than 3-4 centimeters or over 5 centimeters, certainly it needs to be removed, and it can be removed very cosmetically, placing the incision around the nipple areolar region so that the scar is invisible. And with oncoplastic surgery, even though you will remove a large lump, we can cover the defect by oncoplastic technique. So after the operation, once the wound heals, you can hardly see the scar. After removing, will it come back? No. Answer is no. Sorry? After removing, will it come back? Yeah. If it is removed properly, it should not come back. It's not like cancer where it can recur. But if it is removed incompletely, it will regrow. But if it is removed properly, it should not grow. Okay. Everyone is answered. Any more questions? Yeah.
So is there a reason for cysts to occur?
Yeah, cysts occur again because of hormonal fluctuation, increased sensitivity of the breast to hormonal drive within the menstrual period, and they usually occur between 30 to 40 years, just perimenopausal period. They present with a sudden onset of a lump, and majority of the times they are small. Nothing needs to be done. Only when they are very large, when they are causing discomfort, we put a needle under ultrasound guidance and remove the fluid. And they are not cancers, they don't lead to cancers except 1% of them which harbor an intracystic cancer. By and large, they are innocent. No, that is a myth. Wearing a tight dress or wearing an underwear, bra or deodorants, they don't cause breast cancer. It's a myth. I can't hear you.
Is there any way to avoid breast cancer?
Yeah, good question. We can't prevent breast cancer, but as I said to you, physical exercise, avoiding obesity, eating a nutritious diet, all helps. It prevents to an extent, but if they have to fight breast cancer, only two ways: awareness, early detection. That's the only way. There's no way to prevent it entirely.
Okay, and you have mentioned something about eczema, right?
Yes.
Eczema around the nipple area. So, if a person has an eczema at different part of her body, and she also has it around her nipple, if she gets treated by a dermatologist and that dry area is removed, should she still take the triple assessment?
Yes, in the sense, if there is generalized eczema in the body and in the breast, it's unlikely to be breast related. It is probably, it could be psoriasis, it could be so many other things. But localized eczema presenting isolated in the breast is what I was talking to you. But if it is a generalized eczema, which also involves the breast, there is no need to worry.
Okay, thank you.
Yeah.
Does benign lumps causes cancer in future?
Yeah, benign lumps don't lead to cancer in general. There are certain exceptions, but by and large, as I mentioned to you, if it's a simple fibroadenoma, just simple cysts, they don't lead to cancers. By and large, they don't. Yeah.
Good habits. Good habits.
very much. Thank you all.
From screening, diagnosis, and treatment, dealing with breast cancer can be difficult. Words cannot properly explain the deep gratitude and appreciation we have for everything you have shared today. Sir, thank you, not just for taking time and coming here to educate us all, but for all the work you do. Thank you so much, sir. Question and answer section was very informative and interactive. A huge round of applause. Thank you, sir. Now, I would like to request our chief guest to felicitate our eminent speaker, Dr. B. Ranga, and offer him the token of gratitude. Thank you. Now, I call upon the Chair of Women in Engineering, WIE, IEEE OUCs for a vote of thanks.
On behalf of Women in Engineering, I would like to express my heartfelt gratitude to the esteemed speaker and our guest of honor today, and my profound gratitude to Dr. Raghuram Garu for accepting our invitation. He's been very supportive from the beginning, and for all his years of work on bringing awareness, as he says, breast cancer advocacy. Thank you so much, sir. And I would like to thank Lakshmi Narayana Garu, Register OU. So thank you so much for being so encouraging. And our principal, Sriram Venkateshan Garu. And my deep sense of gratitude to all the faculty present here for coming and supporting and allowing our students. And a note of thanks to all the volunteers and organizers for making this event possible. Thank you so much, guys. So can you please come to the front, we'll have a group photo.